Okay, time for this week's SMX medical update with Dr. Joe McGinley. And unfortunately, I guess fortunately, we always talk about injuries with you because that is your area of expertise. And this time, it was Seth HAMMAKER who was battling for this 250 Pro Motocross Championship. And we saw that huge crash he had at High Point, which I think kind of took everybody aback because it was so spectacular. And now we hear that he has a shoulder injury. He, of course, missed Redbud. So we haven't got specific details on what that entails. He is going to have surgery. I have ascertained that. So I guess we can talk through what are the most likely injuries to have happened to him and what is it going to look like moving forward. So I'll get out of the way here and you can walk through what you think may have happened and then what we would have to do to be corrective in that procedure.
Yeah, JT, I was watching that live on TV as well. And when I saw that crash, man, that looked horrific. The fact that he's having surgery, that's not surprising. With that type of injury, the way he had his arm and the way it impacted, we got a good view of that. The number one thing that you're thinking of is shoulder dislocations. And when you have a dislocation, several structures can get injured. You can have the labrum, which, as we discussed before, if you think of it, it's like the gasket of the shoulder joint, keeps everything in place. When you tear the labrum, that creates instability and, a sense of insecurity around that shoulder when you're using it. Other structures that can get injured are ligaments. So ligaments are the supporting structures around the shoulder. And then finally, the rotator cuff. Those are the tendons that create all the motion within the shoulder and shoulder joint. You can always have fractures, impactions as part of that, but looking at that injury, I would suspect there's at least a labral tear as part of that. And that's not surprising with that mechanism of injury, if that were the case. Now, as far as treating labrum injuries, it depends on how significant that labral tear is. If it's a small tear, oftentimes you can get away with conservative treatment. You can let it heal. You can go in and get physiotherapy and get that taken care of. Cell therapy has a great role in that. Both stem cells and PRP can help accelerate that process. If that labrum is more significantly torn and you have instability, that's when you often have to have surgery. So when you have surgery, it pins that labrum back down, it puts that gasket back in place so that you have that confidence in the shoulder. So with those type of surgeries, they can do them through arthroscopic or minimally invasive approaches, but there's still a healing and recovery time afterwards.
Okay, so let's talk time frame. Let's assume the worst, unfortunately, like some labrum tear, something along those lines. If they're going in to have surgery, probably not a great sign. Time frame on coming back, we're always thinking about these playoffs and is it possible or not? What's he looking like before you would realistically see him back on the racetrack?
JT, with the magic of medicine, my predictive value on this has been diminishing. It's incredible what's being done and what the riders are pushing. So, it's hard to say. Obviously, the Nationals are going to be out of the question with the surgery coming up. So the playoffs, that's a different story. I would suspect that he's going to end up missing that, but that depends on how extensive the surgery is. If it's just the labrum, if there's other structures, we don't know the full extent of that, of the injury and the surgery. So it's going to depend a little bit on what they're repairing and then how aggressive the therapy is afterwards to get him back out there. Is it possible to come back for the playoffs? Yes, possible for sure. Likely, I would say it's less likely that he would be back.
Well, it's a bummer. Seth HAMMAKER's really come a long way, and man, just another setback for him. The good news is I think he signed a new contract to stay on that team, so a little pressure off there. But yeah, thanks, Dr. Joe. We'll talk to you next week, and hopefully we don't have a new injury from any of these riders to cover next week.
Thanks, JT. I'll see you at Southwick this weekend. Looking forward to it.